Association of Medical Laboratory Scientists of Nigeria has called on the 36 state governors to implement a special salary structure similar to the federal government of health workers in their state. The Ogun State government has called on residents to sustain healthy communication practices in their environment without contributing to noise pollution as part of the 2025 International Noise Awareness Day celebration. Good day, viewers. Welcome back to DDM Health News Update today on our program, Your Health, Your Wealth. As usual, I often remind you guys to subscribe to our YouTube channel, that is Dashra Digital Media, so as to get the latest on health. Your health is always your wealth. So what do we have today? Contrary to the belief that cataracts mainly occur in older adults, eye specialists say babies and children could be born with it or develop the eye disease due to certain health conditions. The ophthalmologist said pregnant women with uncontrolled diabetes and other metabolic diseases might give birth to babies with cataract, though there are other causes of congenital cataract in children. Each day, one problem. The expert said it was important for pregnant women to have good antenatal care to reduce the risks of pregnancy complications that could cause or affect the eyes of their babies when they are born. So please, if you're pregnant, don't miss antenatal. It's very, very important. Besides diabetes in pregnancy, the ophthalmologist also disclosed that certain infections in pregnancy like rubella, that is German measles, can lead to a woman giving birth to a child with cataract while advising teenage girls to go for rubella vaccination. Please, you have not done that? Try to do so. They noted that cataract in children could either be by birth, that is congenital, or acquired after birth, warning that an injury to the eye could cause cataract in children. However, the physicians who spoke during an exclusive interview on social media said not all cataract in babies and children had a known cause. Well, the World Health Organization says cataract is a clouding of the lens in the eye that normally affects vision, stressing that cataract is the most common cause of blindness and visual impairment, often related to aging. The global body, however, said occasionally children are born with the condition, or a cataract may develop following an eye injury or as a result of inflammation or other diseases such as glaucoma or diabetes. Sometimes, the development of cataract is linked to steroid use, or it may develop after exposure to some types of radiation. So, speaking with our correspondent, that is a pediatric ophthalmologist, Dr. Halima Alimi, also disclosed that some cataract in children could also be hereditary, assuring that children with significant cataract should be effectively treated by surgery. Because that's the only way to remove them. The eye expert, who is the executive director of Restore Foundation for Child Sight, a non-government organization that advocates for improved eye care for children, said parents should ensure that their babies go for routine eye checks after 6 months of birth to detect the condition early before it negatively impacts on the overall growth and development of the child. Please, don't forget that. If your child is 6 months now, please take he or she to the hospital. Giving insight into why children also suffer from cataract like older people, Alimi explained, why children suffer cataract is because of the variety of things that potentially upset the clarity of the lens of a child's eye. And so we have said that it can be congenital or acquired. Part of the congenital causes of cataracts are children whose mothers suffer from certain infections while they are pregnant with them, which we call intrauterine infections. Most of them are viruses, and there are a host of diseases that pregnant mothers can have. So, top on the list is something called rubella. It is a German measles. Please go for antenatal. It is a sort of measles that's a little bit different from the popular measles that we know. It is caused by the rubella virus. That is why it's called rubella. So when a pregnant woman is affected by German measles, the virus will go ahead to cross the placenta and infect the baby depending on the stage of the pregnancy at which it infects the baby. If it is in the early stage of the pregnancy when the eyes are still developing, it can cause congenital cataract as well as other problems that the child may be born with. Hope you don't want to transfer cataract to your child. This is one of the most common causes of infective cataract in children born with it. So please don't miss your antenatal. And then also children, those whose mothers have certain metabolic diseases such as an uncontrolled diabetes, the children themselves, if they are born diabetic and other metabolic diseases, can cause cataract as well. According to an international non-governmental organization that works with partners in developing countries to treat and prevent avoidable blindness, sight savers, cataract, they say cataracts are one of the leading causes of visual impairment and blindness in children. Don't allow your child to get blind. Alimi also pointed out that there are a variety of other causes of cataracts in children that are not congenital but are acquired. Things like injury. We all know that children can suffer eye injury from moderate to severe. So if an injury is severe enough, it can result in cataract just by having an injury. So please be careful with your eye, with your child's eye. Injury is the cause of cataract occurring in one eye in children. Inflammation inside the eye can lead to cataract in children if not handled effectively. That is why we discourage self-medication. What kind of thing do you put in your child's eye? Well, the ophthalmologist also said genetically inherited diseases and indiscriminate use of steroids can cause cataract in children. On signs of cataract in children, Alemi identified delayed milestones such as sighting, social smile, walking, and standing as some of the early indications, urging parents to establish the habit of routine and annual eye checks for their children. According to her, squinting during bright light, a white dot within the eye, abnormal movement of the eye, not focusing when looking, and squinting the eyelids when there is sunlight are also some of the signs of cataract in children. So try to monitor your child's eye. Commenting on the treatments, the eye specialist said cataracts, when they are significant, are treated surgically, adding also that vision rehabilitation for the children after the surgery will enable them know how to use their spectacles and how to maintain good eyesight. She said cataract in children could be prevented through immunization in pregnancy, optimal antenatal care, prevention of injury, avoidance of drug abuse, vaccination of teenage girls against rubella. Please take note of all these things that I just mentioned. A consultant ophthalmic surgeon, Dr. Folasade Fasina, said that cataract is the most common cause of blindness in Nigeria. I keep on repeating this. Don't joke with that disease. The ophthalmologist disclosed that cataract is treated by the removal of the cloudy lens, adding that this is replaced with a clear artificial lenses. She stressed that the removal can only be done through surgery. Fasina explained, there are various methods of removal, but all are surgical. So if this pattern or the other one, they are all surgical processes. Diagnosis is made when a doctor, an eye specialist, examines and carries out some tests on a patient complaining of blurred vision. Cataract is treated by an ophthalmologist who performs surgery on the eye. When the cataract is still small, vision can be improved with prescribed glasses, but the definitive treatment is surgery. So don't depend on spectacles. In a 2021 study published in Science Daily, researchers from Denmark found that mothers who have diabetes before or during their pregnancy are more likely to have children who go on to develop eye problems. So what is your sugar level during pregnancy? Don't miss to check it. The researchers analyzed the associations between maternal diabetes before or during pregnancy and the risk of high refractive error. Conditions in which there is a failure of the eye to properly focus image on the retina. They advise that early screening for eye disorders in the children of mothers with diabetes may play an important role in maintaining good eyesight health. That is why I always encourage pregnant women, don't miss your antenatal, please. Next, the Association of Medical Laboratory Scientists of Nigeria has called on the 36 state governors to implement a special salary structure similar to the federal government of health workers in their states. The association noted that prioritizing the welfare of health workers and implementing such salary structures would enhance job satisfaction, retention, and overall healthcare delivery. Wonderful. The association's president, Dr. Uche Odionyema, in a statement made available on social media, noted that a well-compensated healthcare workforce is crucial to a productive nation. I agree with you. Odionyema, however, commended the Abia State governor, that is Governor Alex Oti, for approving the Abia State Health Workers Salary Scale, which became effective on May 1st, 2025. That is the Workers' Day. Congratulations to you guys. He stressed that the step confirmed Governor Oti's commitment to improving the welfare of health workers in Abia State. Okay? The AMLSN also urged other state governors to follow suit, adding that investing in health workers is like investing in the well-being of our citizens. Of course, without health workers, how are we going to survive? We can't. Well, the statement further reads, the Association of Medical Laboratory Scientists of Nigeria commends Abia State Governor Alex Oti for approving the Abia State Health Workers Salary Scale, effective May 1st, 2025. This bold move demonstrates Governor Oti's commitment to improving the welfare of health workers in Abia State. Kudos to Abias. By this, the governor is fulfilling some of the promises he made during the 60th anniversary of the Association of Medical Laboratory Scientists of Nigeria, which held in Umuahia, that is the MLSN, Abia State in November 2024. Ashworth brings Abia State's health workers' salaries in line with their federal counterparts, benefiting doctors, nurses, pharmacists, physiotherapists, optometrists, medical laboratory scientists, and radiographers. So, in fact, everybody inside the medical line are benefiting. AMLSN appreciates Governor Oti's leadership in prioritizing the welfare of health workers. We urge other state governors to follow this example, recognizing that a well-compensated healthcare workforce is crucial to a productive nation. Please, other governments, follow the footsteps. We call on all governments across Nigeria to prioritize the welfare of health workers, implementing similar salary structures to enhance job satisfaction, retention, and overall healthcare delivery. Please, governors, take note. Finally, the Ogun State government has called on residents to sustain healthy communication practices in their environment without contributing to noise pollution as part of the 2025 International Noise Awareness Day celebration. In a statement released to mark the occasion, the Commissioner for Environment, Ola Oresanya, emphasized the importance of responsible communication. He made a call under this year's theme, which stated, protect your hearing, protect your health. Orisanya noted that while communication is vital, noise pollution remains not just an environmental issue, but also a major public concern. Yes. He described it as a nuisance that has serious implications for public health and overall quality of life. Of course, I support that. The commissioner urged citizens to be more conscious of the noise they generate and to take deliberate steps towards creating quieter, healthier environments. In a realization of this, the Ministry of Environment is using the celebration to remind residents of the maximum permissible noise level for residential places, places of worship, places of entertainment, and commercial areas. For residential areas, the permissible level is 50 decibels during daytime and 35 decibels during nighttime. For places of worship, the permissible level of daytime is 60 decibels and 40 decibels during nighttime, while that of places of entertainment and commercial areas are equally pegged at 60 and 40 decibels for day and night. Oresanya called on households, community leaders, and operators of entertainment and commercial centers to strictly adhere to the standard decibel limits applicable to them, warning that violators would face sanctions. Okay? According to him, the state government sanctioned 175 noise polluters in 2024, including religious centers, entertainment venues, and also commercial outlets. Out of this number, 45 were shut down completely for failing to comply with regulations. The commissioner also urged community development associations across the state to establish and enforce permissible noise levels within their neighborhoods. Please, don't disturb your neighbor as much. It's part of health. It is called noise pollution. He stressed that such limits must be collectively agreed upon and respected by all residents. Yes, at least consider your neighbor. How does he or she feels? Oresanya further pledged the state government's continued commitment to public awareness campaigns, stakeholder engagement, and the use of moral persuasion as strategies to encourage voluntary compliance with noise regulations. So please, consider who is by your side. There must be a mutual agreement before any other thing. With these viewers, we come to the end of our program on your health, your wealth. Be sure to like, share, comment, and subscribe to our YouTube channel, Dashboard Digital Media, to get the latest on health. Well, until I come your way next, I remain Nenero Michael Inezimi. Thanks for watching. Do have a beautiful day ahead. Bye for now.